Thank you very much. Now, good morning, Ms. Brahma.
Good morning, Lord Brailsford. Our first witness this morning is Judith Turbyne, who is the CEO of Children in Scotland.
Very good, thank you. Good morning, Ms. Turbyne.
Good morning. Very nice to meet you.
Very good to meet you too. When you're ready, Ms. Brahma, please proceed.
Thank you, my lord. Good morning, Ms. Turbyne. Please, could you tell us a bit about your background?
Yeah, I'm currently the CEO of Children in Scotland. Prior to that, I spent a while working with the Scottish Charity Regulator, so I've worked a little bit in the public sector, and prior to that, I worked in international development, again in the charity sector, so I spent most of my working life in the charity or third sector.
Thank you. And could you tell us a bit about Children in Scotland, what the organisation does generally?
Yeah. So Children in Scotland is just celebrated its 30th anniversary, although you can trace it back slightly further if you were willing to. But the formal 30th anniversary, and it came together on the realisation that across Scotland there were really a lot of different kinds of organisation working for and with children and young people, and that actually there is strength in bringing people together, both in terms of learning and developing good practice and policy, challenging when things are not going quite right. So just having that, that group of people together. So it is a membership organisation. We've got about 450 members at the moment, and that's both statutory partners and non-statutory partners. And it works in a variety of different ways with that membership. And at the heart of everything we do are the voices and views of children and young people as well. So I don't know if you want me to go a bit into the work that we do.
I'll ask you about each of those, and then feel free to expand as you see fit. Yeah. Now, I understand you work with children and young people aged between 0 and 26. Yeah. Why that age range?
So that is a wide age range, and you would find in our membership most people have shorter age ranges. Some people only work with early years, some people only work with children, some people work with young people. And I think the choice was to try and take an age range that took into account it's young people leaving care and still having a certain level of protection. So it was trying to cover these transition periods between early years, young children, young people, and then young people who are just becoming independent. So that's why the age range is quite big. And I think I said somewhere in my statement that means that it's sometimes not the experts in each part of that journey, but we are somebody who can bring together organisations who work in each part of that journey.
Great, thank you. So the protections offered to young people leaving care continue until the age of 26?
Yeah, in some ways, in some specific things, yeah.
Thank you.
But particularly if you think about a young person leaving care and transitioning into being independent, that's all happening early 20s, and there's some legal protections, but there's also some informal need to support that young person as they take those independent steps.
Thank you. And you mentioned the importance of children's voices, that's a focus for your charity. Why is that so important, and from what age do you try to make sure children are heard?
Well, we would say it's from any age. If you look at UNCRC and what that actually means, incorporating the rights of the child into Scottish law, it enshrines in those articles the right to be heard and the right to participate in decisions that impact on you, and therefore it's from any age. And of course, that is much more difficult when you're talking about early years and babies. But there are organisations like Starcatchers, who are a member and who we work quite closely with, that do that work in a beautiful and very creative way. So we would say it's important because if you if you don't listen to the people who are going to be impacted by the policies, you might absolutely miss a trick. And it's not that one young person will have all the answers. It's not that two young people will have all the answers. It's not that two children will have all the answers. But what they will do if you bring them together is really point out what it is that they need, and then you can work with that to find out how you can translate that into policy. And if you don't have that voice in the room, what can tend to happen? We've all seen it in different ways in different policy environments. Us very well-intentioned adults thinking that we are still children. I still think I'm 27. That unfortunately is not true. We make decisions and we miss something. We miss something important, and because the context in which we live and work is massively changing all the time, it is these children, babies' children and young people who can really understand that context and can translate that for you in a real way that means your policy is embedded in that experience and not just sort of made up by people who know lots of good things but maybe don't know everything. Yeah.
Thank you. Now I want to look now to the different services and the different areas in which you work, starting off with additional support needs. Could you provide a brief overview of the services that Children in Scotland provides specifically in respect of additional support for learning? Yeah.
So we have a number of specific services. I'm just going to find the page so I get it all in the right order. So the Inquire service is a service that's been running for, I think, 25 years now, and it is a service that is supporting those parents and carers and people supporting children and young people to understand what children and young people's rights are in terms of additional support for learning, and to support them through that process. And it's very much an information service, but it's a very supportive information service, because if you can imagine, if you come into that service, you may be at a stage where you're really finding it difficult to navigate the situation in which you're in. You're maybe worried about the provision your child's getting. You're looking for clarity. You're looking for support. So it's a service that offers information and supportive information along those lines. In order to sort of upskill other parts of the sector on that, there's also sort of an outreach element to that service. So it can really work with different partners so that they understand in depth, what the rights are and how they can be realised, really. And because this is pitched at parents and carers, really, because they're the ones who are generally going through that process, we also realise there's a very big need for children and young people themselves to see themselves in that work. And so we have the reach part of that service, and that is directly for children and young people. What it does is that just translates information into, as easy to access as possible, has lots of children and young people's voices in that space. And what it does is allow children and young people to see themselves, but also to be able to understand and to therefore enter the conversation with their parents, carers, educational provision in a much more informed way. So that's the Inquire service.
Okay, great. Yeah. And I think that runs a helpline.
Yes.
During the pandemic, what was the impact on the helpline? Did you see a change in volumes, topics? Who was contacting you?
Yeah, no, it became, first of all, we had suddenly the direct impact as an organisation was you had to massively pivot how we did that, because we were very much office-based and had a lovely little, helpline place where people sat. And then we had to kind of, do it from home, and we pivoted quite quickly, which was great. I think there was a challenge for the staff there, because one of the joys of all being together in a space is giving support, because some of these calls can be quite upsetting if somebody's going through an upsetting period in their life. So that support element, we had to work out how to do that. In terms of how the call line was used, and it is a call line, but we also respond in written ways, so we'll get emails as well, because some people don't like to do it verbally, and also because it just gives us better scope. We can't run the helpline every day, we don't have enough staff, so other people can come in and give us their challenge or what they're thinking about or what they want to know about by email. What we saw was just, yes, a massive change in topics. So it was right, you know, what happened to children and young people, particularly with additional support for, well, we might talk about that whole intersectionality and how COVID impacted on different children and young people in very different ways. But children and young people with additional support for learning requirements were probably one of the most significantly hit groups, particularly in the educational environment. And so there was just a lot of calls about, what are my rights here? What can I do? I'm really worried about how my child is faring in this world. I'm not sure. And this may, this is one side of the story, but a bit of worry about not being heard, not being listened to, and of course understanding the great strain that was on the educational profession and the school settings and so on, but just a worry. There was a lot of worry about my child really should be in a hub, because I'm not, I can't. They're not learning. They're not doing anything. I cannot give them the infrastructure they need. Some quotations around, for me, my child. This is one example from an autistic child where it was really a big separation between home and school. For some children that's not true. It kind of overlaps. Big separations between home and school. Once there was no school, it was just home, and there was no way of getting any kind of learning going on. So how was that stimulated? And because it was really difficult for teachers to, and we can see again some amazing examples of very good practice, but a lot of teachers finding it difficult at the start to get to grips with how to engage with children and young people virtually. There wasn't that kind of individualised support that people need, particularly if they have additional support needs. That kind of went by the wayside, and so there was just a lot of calls around that, and what are my rights, and what can I do, and who can I talk to, and so there was an upsurge of that. There was and we can get the figures very specifically to you if that's necessary. There's some in my paper, but we have very many more about the numbers, and it did go. There was times where it peaked, obviously because of what was going on in the external environment.
Yeah, thank you. And you've mentioned there that, I'm aware that you have a number of studies or you have information on various topics. Did you collect that information through analysing helpline numbers, or was there some element of anecdotal evidence gathering, or did you commission formal research? What mechanisms did you use to gather impacts? Yeah,
one of the very best ways of gathering information is by just being systematic in how you record what's going on with the helpline and the emails. And so that is an ongoing thing for us, so that we can track if there's an emerging theme, what can we do? Because individual cases, that's fine. If there's one individual case, you want to deal with that case. But if there's an emerging theme, you want to deal with that theme. So we try to make sure that what we're doing is capturing that information through the helpline, through the emails that are coming in, and using that to inform, anything that we take to the next level and talk about and so on. So that's a big part of what we do, and that you would see that information in sort of consultation responses that came out after the pandemic from Inquire and from Children in Scotland as a whole. So that is the meat really of the information that we had. But obviously we have other sources of information, some of it being because one of the great ways of adding richness to that information is that kind of more qualitative kind of information that you get, and we work, and I think again it's in the to a degree it's in the statement. We support the inclusion ambassadors, and they're a group of young people of secondary school age from different kinds of secondary settings, who have additional support needs, and they work through the epidemic, I was saying epidemic, pandemic. We worked with them through the epidemic, so there's a lot of good information coming through that source. So when you have emerging themes, you can then take them to a group like the Inclusion Ambassadors. You can talk to them, you can learn from them, and you can build a bit more depth into what we're hearing, because sometimes one comment or one, is enough information. So that kind of information as well. And then on top of that, there were some specific pieces of work that we either took part in or we led. We did work because we co-support the CPG on children and young people with YouthLink, and they commissioned research, and that was from the organisations that are members of the CPG, so that was quite a wide range, not just an additional support for learning, but that would have come out there. A piece on participation through the pandemic, which was really much more focused on what did participation look like during the pandemic, and were we listening to children and young people's voices, and that was good. And there was other pieces of work through our participation and engagement work that added richness to what went on. So yeah.
Great, thank you. And I do want to come on to speak about the Inclusion Ambassadors and the CPG, the cross-party group study. Before that, I wonder if you could please tell us about the key impacts experienced by pupils with ASN as a result of the Scottish Government's strategic response to the pandemic.
Yeah. So I'm just going to get to my page so that I think one of the most important things to always reinforce is that for children and young people, like any group across society, the impacts were extremely different depending on where you were sitting and what you were doing. Yes. So I've talked about people with additional support for learning, people living in poverty, people from Black and ethnic and Asian minority backgrounds. So specific groups where there would have been the likelihood of a bigger impact. So that's, so that is a very important, because it's not, I was just reflecting before I came in here, and there's some quite nice comments from our Changing Our World group, and we might come back to them as well, during the pandemic, who again reflected on a lot of these different themes, saying that what they felt was that they at the beginning they felt they wouldn't be able to adapt, and then they did adapt. And they didn't want to have to adapt, and they didn't enjoy it, but they adapted, and they were resilient enough to get through that period. And so there's a lot of children and young people who will have done that, and they may need some support with their well-being. There may be some, impacts. There may be some educational impacts for some people, but there's a level of resilience. But that's because of their different supports that comes from their different environment, whether it be family, carers, the wider community. They've got these supports there. For children with additional support needs, again, there would be a varied impact depending on where they were sitting and which families they were sitting within. Because again, you can have somebody with additional support needs who has somebody in the house who's an expert at sort of helping school them, and so it's not like it's a blanket everybody impacted. So I just think it's always important to remember that. Sure. So.
For example, what impact did school closures have on?
Yeah, I think school closures were particularly of a high impact for children and young people with additional support for learning needs, particularly depending on what their needs actually were. But I think for many people, you had a de facto closing down of their rights under additional support for learning. So suddenly, if they had a support worker, they wouldn't have one anymore. If they had, they didn't have the supports they would normally have in school. There wasn't differentiated learning for them. And I think at the very beginning, particularly, and I think I touched on this earlier, but teachers were finding their feet. Some were brilliant from the start, don't get me wrong, but some were finding their feet in terms of how do I actually engage with this community. We were expecting a whole cohort of teachers to suddenly become experts at virtual learning, and that's a skill in itself. So that was difficult enough with people for whom learning was relatively easy. So a group of learners who need additional support to be able to learn, they were not getting the additional support. They weren't getting that kind of differentiated support. They were feeling often quite a disconnect between themselves and the school setting. Again, not all of them, but that would have been the case for quite a number of children and young people. And feeling that, sort of disengaging from that learning journey. And I think that particularly happened at the start of the closures. And of course, then what happens is it's quite difficult. You're always running to catch up then because you've kind of lost a few. You would have lost a few children and young people at the very beginning of that quite difficult journey. So yeah, people would have felt disengaged. I think there was one of the things that people talked quite a lot about was the impacts were higher when people didn't feel they were getting the information they needed. So there's always that thing that, you know, sometimes there's something about feeling in control of what's going on, and I think a lot of children and young people across the board felt out of control in terms of what was actually going on for them. And I think particularly children with additional support for learning needs who would have had additional support to help them on that journey, they felt even more probably out of control. Again, not all of them, but quite a number of them. And then the information coming out and the communication coming out wasn't always as clear as it might have been, and that made that journey more difficult. And of course, as we know, and again, I always like to say, you know, you could see in different parts and different settings some really good examples of practice, but of course the general thing was, you know, the school settings were struggling to deal with the children and young people as a whole, and therefore children with additional support needs were kind of a little bit left to their own devices and not covered in the way they normally would have been covered by the rights they should have under ASL in this country. So I don't know if that answers your question.
Yes. Thank you. And it sounds as though perhaps better communication would have alleviated things somewhat, even if that communication was to say that there is nothing to communicate perhaps at that point, rather than leaving the children wondering. Would you agree? I
certainly think that, I mean, and it's easy to say, right, because we know how difficult it is sometimes when you're in that kind of, you're responding to this massive crisis, and you know, but there is, I think, particularly with children and young people, and probably particularly with children and young people who are in a particularly vulnerable situation, there's almost no such thing as over communication. Do you know what I mean? Because like you won't always hear it the first time, and you won't always absorb it the first time, and we're all like that, even as, you know, grown adults. But you know, so there is that, but also it's the communication and it's the style of communication. So as you can absolutely imagine, it's quite difficult when you're in that let's get the information out there. It's not always in a way that children will really understand or engage with, and because I think that participation piece at the beginning wasn't as great. So if you think about the education, that's probably where we should have prioritised children and young people's engagement. Very difficult to do at the time because, you know, people were only just learning how to do virtual engagement. You know, for us, that was a whole learning journey. But, you know, how to really engage with children about what they need to hear, how they need to hear it, you know, just getting them to check off certain parts of communication. So that could have been stronger. So I think, yes, I'm not saying it would have been easy, but like I think the communication, you know, good communication would have been better. And again, I think it also didn't just vary. So you've got national communication, but I think even at the level of local authorities and at the level of schools, some schools were much better at it than others, as you would imagine, because they're all different little, you know, in different places with different kinds of school communities. And I think there's some really good examples of where schools really try to, you know, engage, because they're the ones who children and young people are most going to engage with at that level. So, but yeah, so it was a varied practice, but yes, in general, there could have been clearer and better, more accessible and better pitched communication, I think, throughout that process.
Thank you. And you mentioned that students didn't have the additional supports that they would have had in the classroom. Were any steps taken? Was anything put in place to try to support them remotely? You know, I can imagine adjusting to, well, as you've said, adjusting to online learning was difficult for everyone. Online communication was difficult for everyone, so then online learning for children with additional needs would have been difficult. Was anything put in place to assist that in place of or instead of support workers?
I think the answer to that is not really, and again, there may be examples, so absolutely happy if somebody comes back and said, there was a really good example here of where this happened, but in general, there was a de facto suspension, not a legal suspension of those, of what would have been in place normally for children in that situation. And so if children were in hubs, they wouldn't have maybe got specific support, but there would have been a realisation, particularly if they're in a hub in their local school, and the school would have been able to support. But I think what you were seeing was a de facto suspension of that support, yeah.
How did teachers deal with that? Because presumably the support workers would help children stay focused and engaged, to not be distracted, to keep up with lessons, deal with behavioural issues. So in the absence of that, how did, I don't know, maybe it's not something you can comment on, but if you can, how did teachers respond to that and maintain the focus and concentration themselves?
Yeah, well, probably I can't give a very nuanced answer to that, but I think what I would say was that I would never underestimate that challenge for teachers, and I think what happened generally was they tried to do a good enough job, and some of them were absolutely sterlingly brilliant, and some you only have to look at my son's learning to realise that even across the secondary thing, he had teachers who were amazing, and I will not name any names, but and others who were really struggling to get that piece. So if you're in that context, what you could see was they would engage with the ones who were engaging, and they would try to engage, they would try and bring people back on, but it was very, very difficult to do remotely, because they didn't have the power to talk to the student, because if the student wasn't talking, if you're not, you don't have, they're sitting in their homes or wherever they're sitting, and they have the choice of engaging and not engaging, and you can't really encourage it in the same way. That virtual space is not going to do it so much. An email, whatever, it's very difficult. So I think teachers tried, but it wasn't an easy thing to do in that virtual space. And I think one of the things is learnings, hopefully we will never be in that situation again, but some of the learnings that will be helpful, I think, going forward is that, the teachers who were better able to deal with, a wide range of learners were those who had those virtual skills and had, bit by bit honed these skills actually through lockdown and beyond. So how do we make sure that is something that all teachers have? Because it's not just useful for, a pandemic, it's useful if, a child has to go away for, there's other ways that we could use that at other points. There'll be other times it'll be a very useful skill. So how do we build on those skills and make sure that teachers have those skills? Because some of them really do, and some of them would not have had these skills and would really, and then we were asking a lot, weren't we, for them to suddenly become experts at virtual learning when all they've done their whole life is stood in front of a class and interacted with children. So I think, to answer your question at a very high level, what you would see is just a level of disengagement because it was difficult to use the normal mechanisms to try and bring children and young people back in.
Thank you. And you mentioned hub schools. What were the impacts experienced by pupils with additional support needs in relation to accessing those places in hub schools?
Again, that's a very mixed picture, but through the Inquire line, and also through the inclusion of masters and so on, what you were finding is that the definition of vulnerable child was sometimes a little bit, I think it's difficult to say, but it seemed to vary between different areas, and it was hard for you, if your child wasn't classed as vulnerable, it was hard to make a case that your child was vulnerable, and actually that's a difficult situation to put you in. Yes, I've got this really vulnerable child, but actually the vulnerability was in the learning rather than perhaps in the circumstance, but that wasn't necessarily one of the criteria that was taken into account in terms of hub schools. So I think what you found was children who probably could have benefited benefited from being in that space, not being able to because of the definitions, and again, a bit of a varied picture across the country. Yeah.
Thank you. Sorry. So, given that, really it seems that it came down to where you were, how fortunate you were to be somewhere where your child's circumstances fit the criteria. How do you think in future we could ensure greater uniformity so that it's not essentially a postcode lottery?
Well, it's a great question. I'm not sure that you can ever avoid it completely, because however good your criteria are, the interpretation of that criteria will probably vary from place to place. But again, this is easy in hindsight, but perhaps a little bit more thinking through, particularly that ASL bit at the start, in terms of what are these criteria, and sort of allowing, because it might depend on which area you're working in. You might have slightly different circumstances. You might want to widen that criteria, and that might be okay. But particularly, there's particular groups of people that are going to be impacted by something like that. So additional support for learning. So a bit more thinking through that at the start, and a bit more input, again, that participation and engagement piece of how this could work well. But it's absolutely true that you could give everybody in this room a criteria and they might interpret it in a slightly different way, and all you can do to try and keep people on track is then to inspect that. You don't want to go down that line, because you're going to end up having too many resources spent on something that's useful, but you have to have clear criteria, you have to have time, and that's very difficult during the pandemic, to have the time to develop the criteria. But also perhaps the revisiting of that, and I would have to say, I would have to reflect on that with colleagues, how much that happened, but you could imagine there probably was a space to have a review of that, like at some point, to see, are we getting this right? Are there people who are feeling excluded from this? Should we be having conversations with them? And even in that world, if you get all that right, it might still be that somebody falls out with that criteria. So then the question becomes more, you've got a hub school, what do we do with these children who are not included there but still have some support needs? How can we use that virtual environment differently to include them in their learning?
And do you think that local authority resources, in terms of finances and space, impacted how some local authorities interpreted the criteria? So, if funds were very limited, they maybe prioritised children who had difficult living situations over those with better living situations who were just cognitively or emotionally affected by not being there. And if that's the case, do you think more funding could be part of the solution if more funding was available?
If more funding was available. I'm always wary about saying, yes, let's give more money, because I sort of realise that there's not always more money to give. But genuinely, I think the space is less of an issue when you've got I suppose depending where you are, but mostly you would have the places that you could use, because you would not be using the schools for other things. There's a bit of a question about the costs around some of that, but that's fine. But there's obviously a case that if you had more resources, you could staff that hub in a different way. You could support teachers in a different way to sort of turn over, because it was quite difficult, I think, for schools to manage that as well. So I think, yes, resourcing could be part of it, but sometimes we go to the resources when actually what we need to do is just to go back and say, how would this have, because if we had magnificent resources, we probably could have had a very different model of how we did this. So it's not that I'm saying just throw money at it. I'm saying, a bit of extra resource would have been good, but the extra resource that probably would have been really good as well is that time to reflect and whatever, which is something that really goes in a time of crisis often, because you're just running to keep up. So how do we reserve that thinking and reflecting time, so that you, first of all, you get your criteria, you work out what's going, but then you have the time to go and refine it as you go and not be stuck because this was said at the beginning, which is what will tend to happen because you don't have the time to do the appropriate reflection and so on.
Could engaging more and earlier with third sector organisations help there with the consideration, planning and review of the needs?
I think it has to be a partnership, absolutely. And if you look at each local authority area will have some really, and they'll have strong partnerships already through planning partnerships and so on, where the third sector are very involved. And there was a degree of cooperation, but absolutely, I think there is something to be said for that collaboration piece, putting that front and centre. And of course, what we know about that collaboration piece, it sometimes means that at the start it takes slightly longer to get off the ground, because people often talk about collaboration like it's easy, but you know, we could sit in a room and we fundamentally agree, but actually it still takes 3 days to come to the, but what does this look like? So collaboration does take a little bit of time, but actually the investment in that in the start probably gives you additional resource, because the one thing that did happen during one of the good things that happened during the pandemic was a bit more of that agility around funding models and so on. So it allowed organisations to do it differently. So if you have that collaboration piece very much front and centre at the beginning, then what you can probably do is you can leverage different kinds of resources in different ways to play different roles, and it has to be a partnership. When it's a pandemic, it has to be a massive partnership to kind of get this to work.
Thank you. And what impact did the government's strategic response have on transition planning for pupils with additional support needs?
Particularly older ones, you mean, sort of moving into housing? Yeah. So,
from maybe primary school into secondary school, and then from secondary school onwards to... Well, and then out of education.
I think when you look at the journey of a child and a young person, particularly a child and a young person with additional support needs, transitions are real key moments that are often extremely difficult. It depends on the child, and it depends on what particular challenges they are facing, but that moving from one place where perhaps a lot of work has been done to make them feel safe, included, on a good learning journey when everything goes well, to move from that to something else that's scary. I think we all remember moving from primary to secondary and being absolutely, well, maybe not in this room, but I was absolutely terrified, and I had no, you know, and I was a very academic child and quite delighted with school. So that transition is a very anxiety-making time for children and young people, and similarly for those moving out of whichever secondary setting they're in into whatever comes next, can be a very big scary place for people to be. These I think were groups of people who, when we talk about the different impacts on population, the impacts would have been even sharper for those children making those transitions. And it will be interesting in a couple of years to sort of trace that disengagement perhaps from secondary school from children who have moved at that time, because I think it was very difficult for children to get a foothold into their secondary experience. And again, as I've said, sometimes when it's not insurmountable, you can do something about it afterwards, but if you've lost, but if a child has become disconnected at that early stage, it's actually sometimes quite difficult to bring them back. So I think that transition phase is really difficult, and it was very difficult to do something about it in lockdown because there wasn't much option to bring children out of their space, their comfortable space, hopefully comfortable space, not always at home or in their home setting, and show them what they were coming into and building relationships. We all know in that new experience, when you are facing a new world, one of the things that really helps you is those links that you build with your teachers, if you have a support worker, with your support worker, with your peers, and none of that could really happen. And that's you can make it happen virtually, but it is much more difficult. It takes a lot of time to build those trusting relationships. So that was one area that I think was highly impacted, and I'm not sure there's an easy solution to that, but I think when planning for something like this in the future is particularly what do we do about these transitions, what do we do about supporting children and young people through these transitions, because fundamentally they are, it's a very vulnerable time for any child or young person, and particularly for somebody with additional support needs.
Thank you. And can you tell us about the impact of the pandemic and the response to the pandemic on attendance and attainment for pupils with ASN, with exams taking place remotely? You know, it was difficult for all children. What were the particular challenges, and do you have an idea of attainment results for children with ASN?
I think, again, this will be more of an anecdotal answer, but we can go back and get more specific specific figures for you. But I think the evidence suggests that with a level of disengagement, not with all children and young people, but a level of disengagement for young people kind of hitting that, and particularly hitting exam times, I think you found quite a lot of children withdrawing to the extent that not really flourishing in that space. And I think that would be true at that exam level, but very much true at all levels in terms of their ability to really fulfil their potential. And what you saw on going back, moving back into school, was that the gap between children with additional support needs and children who didn't have the same challenges was that the gap was widening, and it's sort of not a surprising result, but it's a saddening result, because obviously, again, how to invest in those children and young people and bring them back up to where they would have been is quite a challenging thing to do. So yes, I think it has an impact on, once you're disconnected from your learning journey, it's quite difficult then to really fulfil your potential, whether it be through some kind of examination. One of the things that was interesting though, and on the flip side of that, was one of the learnings, and I know it's being taken into account as we go forward thinking about education and education reform, for some children who are not, big into exams, the changing of the way some of that was done was quite interesting. So even for children who didn't have additional support needs, that thing is like, the exam and the way that happens and the anxiety that produces, the change to a different kind of approach was quite interesting for some people, and they found that quite a positive way of having themselves judged academically by their teachers who knew them well, and so on. So there's a flip side to that, and some learning of what the best mix of all that is as you go forward.
Thank you. And in relation to that, you touched there on the ongoing impacts that the differences in attainment and attendance engagement can still be seen. I think you mentioned in your statement there are more part-time timetables now and a continued lowering of support. How is that? What levels are you seeing that continue at, and are there any proposals for addressing that? Or are there any strategies that have been created to try to address that, to increase this?
Yeah, so particularly around the gap and part-time timetables,
lower support levels.
Yeah, no, it is very interesting, because you are seeing an ongoing disengagement. I mean, you're seeing ongoing disengagement where it's not just part-time, where people have disengaged completely from school. And in terms of numbers, I'm not going to give you numbers because I'll give you the wrong numbers, but it's a significant shift at the moment towards that. And clearly, of course, for some children that might work quite well, a part-time time. Maybe for some children we need to think of that as a way forward, but for many children what they're missing out on is a fulsome education, a fulsome learning journey. I think the problem is, particularly around additional support for learning, one of the challenges is, if you look at the action plan that goes alongside additional support for learning, it's quite a good action plan. It's good, it's founded in good thinking. And this is where I will come to resources, because I think there is a challenge around resourcing that. We can't just expect teachers to be able to do all of that without the sufficient resource to be able to do that. Now, again, I know we're in an era where we have to think about how we're going to get that resource and how we're going to prioritise that resource, so I'm not being glib about this, but there is something very, very important about going, we've really moved back on support levels from quite a number of years ago. We're not even back at the levels that we had then. So we really need to invest in that area of work, because that's where you can actually support children on their journey to not only be learning, but to be probably enjoying their learning, or at least some of it, and to be more enthusiastic about that, to want to come into to school and to do their, to do what they can in order to take the next steps in their journey. So without that investment, and that investment, it was pre-pandemic that the levels had gone down in terms of the investment in that support piece. And without that investment, it's very difficult to see that changing anytime soon, because we know the stress on the teaching, the overall teaching complement and support workers that are in school at the moment. So how do we, and some of it's about prioritisation. I say it's never too late to look at the thing as a whole, but some of this is actually about that resourcing of that piece of the puzzle, because without that, it is it's the thing that oils the system, that makes it possible for our children and young people with additional support needs to really be supported through their learning journey.
Thank you. And I want to ask you about the physical and behavioural aspects of schools reopening, things like mask wearing, physical distancing, ventilation, bubbles and testing. What impacts did children with additional support needs feel in respect of those things? Yeah,
I think that they were that's a group that was particularly impacted by that stuff. Some people were just kind of like, it's all a big, not a joke, but just get on with it and it's fine. For many people, that's quite anxiety provoking, the anxiety around, and particularly if you had an ill relative or a vulnerable relative at home, or if you had a granny or a granddad, all these things that were quite anxiety provoking. There would be an over representation of people with that would be highly anxious about that kind of stuff amongst that cohort, and so it meant that step was really difficult. So that's why you found some children, young people who maybe weren't disengaged, finding it difficult to go back to school and to be in that environment that felt quite risky, and kind of just being quite worried about what that meant for them, but also what that might mean for their loved ones at home and so on. So I think it was a group that was particularly impacted by that. Now, again, how do you balance all that? Because clearly for many children, getting back to school was absolutely the very best thing ever, but the fact that the people who were the children and young people with additional support needs who were less likely to go back to school because of a lot of these measures. So that meant again that the gap, that kind of allowed that gap to slightly develop in terms of just their learning journey and what they were able to do after that. Because then it was quite difficult for teachers to manage children back at school and then children who weren't attending school, because that again is a sort of a double, how do you engage with those children? So yeah, I think that did have a significant impact on a particular cohort within children and young people with additional support needs.
Thank you. And I want to now move on to the Inclusion Ambassadors group. You touched on it briefly, but could you give us an overview of their role and who forms the group?
Yeah, so they were formed, I'm just going to get the date, 2016. Education Scotland wanted to engage with because one of the great things you can do with participation and engagement is engage over the longer term, not just have short-term bit of participation over here, but engage over the long term so you can learn together about things. So they wanted to form a group of children and young people, secondary school pupils, and from other settings actually, who had additional support needs, so that they could learn together and that could influence what they did and how they did it. So they formed that, and we supported the work from the beginning as Children in Scotland, but there came a point when Education Scotland said, I think this probably sits better with Children in Scotland than with Education Scotland, so we took over, so they now, we facilitate the work, so we support the group. And they, as I say, come from a variety of some come from specialist settings, some come from traditional secondary schools, and they all have additional support needs, and really work together with us. We support that learning to kind of look at different areas that's challenging for them, but also trying to not just look at the bad stuff, because it's very easy also to look at the bad stuff, but also to try and look at what best practice might look like in those settings in terms of additional support needs.
Thank you. And how is the group funded? Is it funded through the government, or do you have to do fundraising?
No, we don't. Not for that. No, that is fully funded, which is lovely, because as you can imagine, funding at the moment is well, not. So yeah, that's fully funded because it is something that's a sort of ongoing piece of work. I don't know how long that will last for, but because good participation and engagement work, and again, all these things cost money. It does cost a chunk of money because you want to do it well, you want to properly support your young people, you want to make sure that they feel supported, you have enough staff to support them, you do it in a safe way, in a safe environment. So all that is quite, it does take a bit of funding. So yes, it's fully funded.
Brilliant.
Yeah.
Great. And how many children and young people are involved with the group?
It does vary time to time. I think we had some numbers in here. There's sort of about 20 members at any given time. It does, a lot of them, they stay, often when somebody comes onto the group, they do stay for quite a long time during their journey, but obviously once they've moved on, they go off the group. Then other people will go off for other reasons, they're no longer, so it does get regenerated, but it's around 20 people at a time, yeah.
Great. And what are the membership requirements?
They have to be enthusiastic. They have to want. This is not for everybody. You're sort of sitting around talking about what it is that you want and need and whatever. So they have to have additional support needs because it is that specifically what the group's about. So and they have to really want to, because in a way you can never get somebody to represent their whole community, but they have to be able to then go back to they want to be able to go back to their schools and talk, or their setting, and talk about what's going on and try to learn from that. So it's quite an easy criteria to meet, but not everybody comes forward, as you can imagine, for that kind of role. So yeah.
And are they all secondary school pupils?
Yeah, it's a secondary school program. It would work well for primary school as well, but at the moment we're not resourced to do that, so and we don't have extra money, so because it would be a lovely thing to see it through the whole journey, really. Yeah.
Thank you. And do you know how frequently the group met between January 2020 and December 2022?
I think the figures we have between March 2020 and December 2022, 20 times. Actually, it says over 20 times, so quite a lot. But that would have been all. Pretty much all virtual. A lot of it would be virtual. So we spent a bit of time at the beginning of the pandemic, both with Inclusion Ambassadors and Changing Our World, which is our advisory group, really working out how to do participation and engagement work online, because we'd always done it face to face. That was just what we did. I think we did the odd thing online, but so how to do it well online, and it took us a few weeks to kind of work that out, and then once we had worked that out, that pretty much everybody's online, and even now what we do is 2 out of every 3 would be online, but we do get together, because if you getting together gets the richness. So yeah, 20 times over that period. Yeah.
And how does that compare to pre-pandemic figures? Was it broadly the same once you were set up?
I think it's slightly higher. It's slightly higher, yes, but I can check that for you. I think it's slightly higher because that's quite a lot, really. That's almost once a month. No, it's not. My maths have just failed me. It's more than it's less than once a month. Once every 2 months. Yeah, I'll check that. Yeah. Because you know, it's good to have continuity, but you're also aware that you're taking children and young people out of their day-to-day. So I will check that. I think it's slightly higher.
Yeah. Thank you. And I want to move on now to the Resolve service. Can you tell us a bit about that, please?
Yeah, so Resolve is a mediation service, but again, around additional support needs. So it supports when there's a bit of a dispute between a family, a parent, a carer, and the education establishment, the local authority. They are a mediation service that supports both parties to try and come to a conclusion. Now, obviously, if both parties have to want to come to conclusions, you want to have to come to mediation, so it has to be something that people are willing to do, and not everybody is, but if they're willing to come to that, then Resolve will take that on and hopefully come to a stage where they can come to an agreement about what is going to happen for the child, where their school provision is going to be, and hopefully they can move that forward. Now, in every case, as you can imagine, that doesn't happen, but that is the intention of the service, and it does have good results. So yeah.
Thank you. And what were the challenges of that being delivered online in terms of safety, confidentiality, reading emotions, managing emotions that
Back on now.
Thank you. Right, Ms. Barami, I understand the problem has been sorted.
Yes.
Don't worry about this at all, Ms. Turbyne. It wasn't your fault. No harm done.
Fine.
When you're ready, Ms. Barami.
Thank you, my lord. Ms. Turbyne, would you like to continue there? So we were speaking about the impact on mediation services and the challenges of delivering that online.
Yeah, there were some particular challenges around that because, as you can imagine, people, when they've reached that stage, are often quite emotional about what is going on. And one of the strengths, one of the things that helps in mediation often is to take people out of their normal day-to-day into a space that feels a bit safer, perhaps, or just at least a bit distant from their day-to-day lives. And that was impossible because you just had to do it online in the home. Also, there's a real thing about confidentiality in that space because you might not know who's listening to that, and so all you could do was mitigate that to the best of your ability, and try to make sure that you were being as safe as you possibly could be. So there were some real challenges to that. It had to take a bit of an approach that this case, we can't, this very urgent, we really need to deal with this. The family's ready, the local authorities ready, we'll go ahead with this and try to put the mitigations in place and really learn also how to work with that emotion on an online space, which again was a bit of a learning for people, because it isn't the same. It's quite difficult sometimes to read the body language. If somebody's escalating, it's quite difficult sometimes to bring it down. It's easier. Well, it can be easier face to face, and sometimes I think people feel a little bit more liberated to be to say things in certain ways when they're online, because it's because they're not face to face with somebody, and there's something quite powerful about seeing us all as humans in a room trying to mediate a situation and not as little boxes on a screen, and to being a bit distant to that. So some real challenges there. As I say, it was a bit of a learning curve for the service and for the people who worked in that service. The evidence is that it worked well. What we did learn from it was that one of the things that it's very time consuming for families who are sometimes in difficult situations to always come, depends where you're doing the mediation, to always come and move from the home. So some of the prep we still can do online now, so that helps with that. That kind of frees up their time and makes it a wee bit easier. But of course we would have gone back to in person around the nitty gritty of the mediation, because that's easier. So there were some positive learnings from it, but it was challenging, and I think you can never say that you mitigated all of the difficulties that might have occurred. But on the whole, the service was very happy with the results, but it was a bit of a learning curve for us.
Thank you.
Now, Ms. Barami, you've got about 10 minutes left.
Thank you, my lord. And with an eye on time, I'd like to move on to the mental health impacts. Could you tell us a bit about the mental health impacts on children and why the impacts on children were different to adults? Were there different presentations of the impacts?
Yeah, I think, and this is something that you could talk about for a good few hours on its own. I'm assuming you'll be coming back to this with a number of people. There are real moments in children and young people's lives where sort of isolation, lack of peer support, an inability perhaps, to, particularly if you're living in difficult family circumstances, and perhaps your safety net was elsewhere, where you suddenly can become much more, particularly if you're prone to that. Again, as I say, this will not be true for everybody. There might even be children and young people who had positive impacts from, not engaging in, in certainly, but mostly for many young children, young people, particularly people who perhaps had social anxiety in the first place, sort of removing themselves again from that space, or being removed from that space. They didn't remove themselves, removed from that space, not making these peer relationships can lead to that social isolation. And then there is that whole journey that a young person can go on, particularly if they're developing emotionally, hormonally, all the different things, where things become quite internalized, and that can become quite a very difficult thing for a child and a young person to deal with. And at the same time that there's less support out there, you're actually having to deal with that more and more. And again, there will be children and young people who will have had support in different ways, either in the home or out with the home, but there will be many children who will have been left with this quite difficult social anxiety. Now, it doesn't mean that everybody is going to have serious mental health problems going forward, but I think what it means is that there is for some children and young people, there are going to be impacts that we won't even necessarily see the impacts of that for a number of years. You know, I think for some young people it's going to take a while for them to really work through what's going on with them. For some children, we've talked about children who didn't like it and had a tough time, but you know, will be okay and will come out the other side, and you know, we'll have different experiences on that. And then you will have the people who have had these serious impacts where they've been perhaps become socially isolated. Their anxiety has kind of become grooved into something deeper, something more difficult. And then of course what you're finding now is that it's difficult for those children and young people to get the impacts. Now, I would say there's lots of adults also who will have suffered similarly, because there'll be adults who are walking that fine line to keep themselves mentally healthy, and isolation will have really not help with that at all. But for children and young people, because they're on that very fast journey, we know what it's like for a child. A year is a very long length of time for them, and they have missed those connections that they would normally make, and that would have helped them in their emotional journey and will have helped them in building their resilience as a child, as a young person, and as a young adult. So, and again, I think when you look at children and young people, it's in certain moments as well that it's more difficult. And again, some of this, I would love to go back and do another PhD and look at some of these elements, because I think for some children, there will be, who are going through that transition phase, you know, a different element, you know, are going through puberty, different impacts because of both the physical and mental changes that they're going through, and that normally would be a bit messy, let's face it, but they would have other supports out there that would be helping them, you know, indulge in the behaviours that would help them get through, some of them good, some of them bad, but that would help them learn how to deal with those different emotions. So, yeah.
Thank you. And in terms of perhaps in future trying to identify those children that should be prioritised in terms of getting help, do you think that in terms of the ongoing impact, the ability to recover, do you think things like geography, family finances, family education levels, are these predictors of the ability to bounce back essentially, or can it not be divided or recognised in that way?
I think that's a great question, because of course there's always there are outliers in all of this. So there's going to be children and young people who have got all the supports and all the, you know, and all you would say, the predictors would say you'll be fine, and they won't be fine. So there will be outliers to that. But I think if you wanted to find where the largest number of children and young people who might be impacted on this, I think you do go back to that intersectional approach as you go. Who were those who were living in poverty and didn't get out of the house at all and didn't have anywhere to go? Who were the children who were living, who were the children with additional support needs? Who were the children who were living who already were showing signs of mental vulnerability, let's say, who were, you know, their well-being wasn't great? There are indicators that would allow you to identify children, but that doesn't mean you shouldn't be alive to the possibility that there's other children out there that will be similarly impacted, and they're just unlucky because, you know, the combination of genes and environment and everything else will, you know, have a serious impact on them. But yes, I think looking at that intersectionality of people who are most vulnerable, that's where you get your best indicators of who's going to be most impacted.
Thank you. And briefly looking at access to community services, you state that one of the main challenges for children was the lack of structure and socialisation. Why is structure and socialisation so important for children generally, and then more specifically for children with additional support needs, and perhaps those that are disadvantaged in other ways, socioeconomic background, care experience, those with disabilities? Could you tell us a bit about the impact on them specifically and the consequences, the long-term consequences of not having access to those opportunities and services?
I think there was a real challenge to children and young people from having, school was taken away, but everything else was taken away as well. And we know that part of making a child resilient, or helping a child be resilient, you're never going to make them, but supporting that journey towards resilience is having different ways of expressing themselves, exploring the world, all these different things which are so important. And very often school will be a small part of that for some children, and it will be the external activities that are a massive part of that. And I think what you find is if children have no access, and there's lots of children who don't have access, we know that, but there's lots of great examples of children who perhaps are not engaging even in the school environment, but who maybe through the youth environment and the sort of the more informal youth sector, where there's lots going on and it's maybe a bit more their bag, that allows them to go on a healthier journey towards resilience and so on. And it's about, I think, people finding out their own self-worth. It's about people having their, what their value is in the world. And children and young people find that in loads of different ways. For some children, school's a massive part of that. For other children, it's their hobbies and activities. For other children, it's being the best gamer in the world. Whatever it is, there's something that helps them, and you find children who tend to be more resilient and healthier, they have some way of being able to engage in those kind of activities. And when through the pandemic, what you found was you had the school shutting down and the informal activities shutting down, but the schools open, but the informal activities didn't until much later. So there was a bit of a lag with that as well. And perhaps we could have been better and quicker about thinking about how to open these spaces. And some of it was about opening, like church halls and scout halls and, whatever, like just the facilities, and then getting the safety around that for the people who were doing the thing. So there was, and I've just mentioned two of the most traditional ones, but there's loads of other different kinds of settings. The dance, dance halls where people go and learn their dancing or music, or all sorts of places where that came on much later. And actually that might be a good learning for the future, because I think for even children that perhaps were disengaging from school, another route back into engaging in school might have been through these more informal ways, because they would have been engaging with their peer group in another way, and that might have brought them back in. So I think it's just that child development is a fascinating subject, but there does have to be some way of children exploring who they are in the world and what their value is to that world, and what makes them such a valuable human being.
Thank you.
You've run out of time, Ms. Morali, I'm afraid.
I'm sorry, my lord, I didn't...
You've run out of time.
Thank you. I was just finishing. I just wanted to ask Ms. Turbyne if there's anything that we haven't covered that you would like to highlight.
No, I think that's been great. There's probably lots of other things I can say. I just think, the best thing that we can do from having such an experience that we've shared all together is to really have that constructive learning piece, and that's certainly what we'd want to contribute to as Children's Scotland. So, yeah.
Thank you very much.
Thank you.
Thank you very much indeed, Ms. Turbyne.
Thank you.
Very good. 11:15 then.
Thank you, my lord.
Now, good morning, Mr. Caskey.
Good morning, my lord.
Voice was a little bit broken up there. I don't know if it's...
I think it might be my voice rather than the recording.
Very good. Right, now we have Mr. Purdie this morning.
That's correct, my lord, yes.
Good. Good morning, Mr. Purdie.
Good morning, my lord.
When you're ready, Mr. Caskey.
Thank you, my lord. Would you tell the inquiry your name, please?
My name is Allister Purdie.
And you are here in your capacity as?
The Director of Operations for the Scottish Prison Service.
And you provide details, you've provided us with a witness statement, which for the purposes of the inquiry is under reference SCI WT 0454501.
Yeah.
In your witness statement at paragraph 3, you provide details of your extensive experience in the prison service. I understand that you started as a prison officer in November 1998.
That's right, Mr. Caskey, yeah.
And you then carried out, or you were then in a series of promoted posts until your current appointment. When did that happen?
That was in March 2020, Mr. Caskey.
Just at the point at which the pandemic struck?
Just right at the start.
Right at the start. Well, I'll ask you a little bit about that. Latterly, you ended up as a governor in a number of prisons sequentially?
Yes, before I took up this role, I was the governor of HMP in YOI Cornton Vale, the governor of Grampian Prison, and the governor of HMP Shorts.
So you have extensive experience in the prison service?
Yes.
And you're now essentially involved at a strategic level, as I understand it. Is that correct?
Yeah, I'm responsible to the Chief Executive of the Scottish Prison Service for the safe delivery of custody and care for individuals across the Scottish Prison Service, and the oversight of private contracts that support the delivery of service to the Scottish Prison Service. That's the escort service and one of our private prisons.
Which one?
That's HMP Addywell.
Okay. Are you involved, again, at a strategic level in the management of Addywell, or are you involved in the day-to-day running of Addywell?
At strategic level, Mr. Caskey.
Okay. Now, again, in the witness statement at paragraph 6 and 7, you provide general information about the Scottish Prison Service, about it being an executive agency, and so on.
Yes.
I don't think it's necessary to go through that. I should say to you today, you're going to be asked questions about impacts from COVID rather than implementation or decision making, although a significant part of your witness statement deals with those latter matters. You'll be asked back to discuss those on a different occasion. At paragraph 9, you say there are 13 publicly managed prisons and 2 custody care units and 2 privately managed prisons. And then you provide useful information about the scale of the operation. You say there are 7,900 individuals roughly in custody.
Correct.
And you have a staff complement of about 4,500.
That's correct.
So it's roughly half a staff member to each prisoner.
Yeah, that's correct. There's only one change to my statement, Mr. Caskey. HMP Kilmarnock came back into the public sector at the weekend, so we only have one private prison now in Scotland.
Which is Addywell?
HMP Addywell.
At paragraph 11, you talk about the vision and mission, which is to develop a person-centred, asset-based approach, yes?
Yes, that's correct.
Okay. And at paragraphs 10 and 11 together, you say that the main function, apart presumably from keeping people in custody, is rehabilitation and integration
Yes, that's
of
correct.
the population.
That's correct, Mr.
You then, at paragraph 12 through to 20, provide information really about the governance during the pandemic. You talk about clinical advisory groups and strategic oversight group and so on. They're not to do with impact, so I'm not going to ask you about those today.
Okay.
I do want to ask you something which crosses the line from impacts into, crosses the line at paragraph 19. You talk about the COVID-19 hub.
Yeah, it was.
Just tell us in general terms what that was.
Yeah, it was the initial hub that was set up to try and control the flow of communication and guidance that was coming at the time from Public Health Scotland, from the Scottish Government and from across our healthcare providers, so that we could make some sense of what was happening, take that advice, create it into operational guidance, and that hub would then distribute that communication across to our sites in Scotland, and also acted as almost like an absorption of questions, what people were doing, what guidance was in place, and how we should actually facilitate movements to courts, for example, and how we could facilitate movement to hospital. So it acted as an information and communications hub.
It sounds to me from the description that it was a two-way filter. You were receiving information from Scottish Government and filtering that down to specific users, as it were, and you were also receiving information up and factoring that in. Can I take you to paragraph 20? And you explain a bit more there about the hub. Tell us how it worked.
We had 3 or 4 senior people in that hub, and as you say, Mr. Caskey, acted as a two-way flow of information, so we did have to report into the Scottish Government about the status of our prison, status of the health within our prison. So the individuals in there would also coordinate with our agencies, with the police regarding escorts, with the court regarding our escorts to the courts, and with our NHS colleagues about the movement across the estate. So we had people in that room, physical people with telephones, communicating both that two-way.
And at paragraph 22, you indicate that one of the people who weren't in that room was Police Scotland.
Yes, that's correct.
You communicated with them by telephone.
Yes, that's correct.
Is that correct?
That's correct.
And again, would that be a two-way communication process?
Yes, that's correct.
And then until we go online, tell me about the move online.
It initially started through our technology only allowed us to do conferencing calls through the telephone system. Once we developed an electronic digital platform, we were able then to actually communicate on the digital platforms to our partners, either in NHS or police or across our agencies. So we were able to do that as the pandemic moved forward.
And when you say digital platforms, do you mean either Zoom or the equivalent of Zoom?
It was Teams, where there was a various amount of platforms at the time. Some agencies used Zoom, some used Teams, and others used, I can't remember, a few other different platforms.
Right. Now, in paragraph 22, you talk about how you fed information back to the Scottish Government. How frequently were you doing that?
At the outset, Mr. Caskey, that was 3 times daily. There was 3 briefings that we had to provide Scottish Government. As the pandemic started to move forward, those briefings became daily, and that continued throughout the course of the pandemic. At times when there were outbreaks, we provided more detailed briefings on the specific case or the specific establishment where the outbreak had happened.
And then at 27, the reason I'm able to jump is because this isn't about implementation, it's about impacts, but we need some background in order to properly understand the impacts. So at 27 you talk about the pandemic plan. Tell us about that again in general terms.
The pandemic plan was a plan that had been developed over a number of years to work with any significant infection. and it had been, the framework had been tested through things like bird flu and different flu pandemics like that. But it was built and developed in conjunction with Public Health Scotland, with our NHS colleagues, and we used that as a framework, our guidance, to communicate through to our establishments and to the people who were delivering the service that was how we should be keeping people safe and how we should be using our standard operating procedures to make sure that things were as safe as they could be. It provided a guidance, and it was our guidance document for our service at the start. And then at paragraph 28, you indicate that was kind of broken down according to the local area. Is that correct? Yeah. Tell us about that. Without going too far into structures, Mr McCaskey, there was a national coronavirus response group that then cascaded that information to local coronavirus response group, which is a multi-agency, and they were run by the governors. And at that time, that communication would flow down there, and it had to be specific because travel restrictions were coming into local authority areas, and different guidance was in play across our estate. So it couldn't be one piece of communication. It had to be developed by our local corona response groups, whether it would be to close down our visits, for example, because travel restrictions were in one area and not another. So that's how it changed. So what you mean by that is, if I'm a prisoner in Barlinnie, but my family are in Edinburgh, and there's differences in the tier that we were in, then the prison had to be aware of that and take cognizance of it in, for example, day release or work parties. Absolutely, all of that. Right. If I can move on to 37. This is in the passage which deals with those in our care. And I note that in the statement you refer to prisoners as those in our care rather than prisoners or those in custody generally. Does that reflect something of the attitude within the organisation? Yes, Mr Caskey, it's a recognised term for the organisation to refer to the people, those in our care who we look after. You talk about a specific difficulty that you faced at 37, which was cell sharing. Get that in the right place. Cell sharing. Tell us how you dealt with that. Just to put it in context, that at that time, with 8,000 people in custody, approximately a third of the Scottish prisons actually have 2 people and more in their cells. So you can imagine, in terms of trying to stop the spread of a pandemic, the first thing we had to do was look at that group of people who were sharing cells to see what capacity we had across the organisation, and if we could remove the amount of people who were sharing cells to try and give people personal space and stop the spread of the pandemic. So that was first part of our assessment across the prison service. I also understand that within the prisons you also set up what might be called bubbles. Yes. Was in the community called bubbles. Can you tell us how that worked in prisons in general? And I'm thinking now in particular of smaller prisons. Yeah. Smaller prisons are made up with a number of small wings, which actually lent themselves to people living in isolation, almost in households or bubbles, so that they were separate from the rest of the population. It allowed socialisation for small groups of people. It allowed access to facilities, showering facilities, hand washing, but it also allowed us to put in place as best a regime as we could for people living in a household without isolating them. So we were able to provide small periods of recreation, periods of exercise and time in the fresh air for small groups of people on an almost rotational basis when we started to close down our prisons to small bubbles. I'll ask about a specific problem in relation to that in a moment or two, but in the smaller prisons, what size were the bubbles roughly? Bubbles could be from 5 to 10 in smaller prisons. And how did that work in the large prisons such as Barlinnie or Saughton? Far more difficult, Mr. Caskey. You can imagine there's 1,300 people in an establishment. The establishment is Victorian design. It doesn't allow itself to be naturally segregated, so some of the bubbles were much larger in our larger establishments, but we followed the same principle. Some of the bubbles could be 20, 30 people, and even sometimes they were up to 40, I think, when we still continued to receive people from the courts.
Now, you also say at paragraph 40...
Are you passing from bubbles, Mr. Caskey?
Sorry?
Are you passing from bubbles?
I am, unless there's anything my Lord wants me to take up.
Well, no, there's something I want to ask about bubbles. Yeah, Mr. Purdie, it's probably my fault, but you mentioned to us, in answer to a question Mr. Caskey put to you a moment or two ago, that you introduced bubbles, and then you explained that they varied in size depending on the nature of the establishment. I understand that. Were bubbles, or did bubbles become the common practice? Were they used in all of your establishments?
Yes, my Lord, in all the establishments, small, medium and large establishments.
But in larger establishments, the bubble was bigger.
Bigger. I understand that. So basically, you moved from the pre-pandemic model whereby your inmates were housed in wings and things like that, into a system whereby people were living in smaller bubbles, and I understand that the size of these bubbles varied. Is that correct?
Yes, that's correct, my Lord. Yeah.
Right. No, that's what I wanted to clarify. Thank you very much for that.
And you also explained that, I think, and clarify this if you can, you rotated things like people getting out for exercise. Take that as an example. Tell me how that worked.
Yes, it was almost like establishments had to put in place a timetable, because previously large numbers of people would take part in activities, purposeful activities and exercise. So when they became smaller households, they had to be almost rotated through a day. So, for example, a larger area or a house block may have had one period of exercise during a day of a given time. That would then be split into perhaps 8 sessions of exercise. So on a rotational basis, people would have time in the fresh air for their health.
You also, I think, used prisoners involved in, or as cleaners in the prisons. Explain about that.
Yeah. When we closed down part of our purposeful activity to try and stop the spread of the virus through our prisons, what we did was we utilised those in our care on hand who had already been trained in cleaning activities. So we upped the cleaning parties, and we then put in place a constant regime of cleaning across our areas and our regimes in every prison.
Presumably because you had available labour.
We had available labour, we had equipment, and we had people who were trained, and therefore that served two purposes. It kept people engaged in purposeful activity, and it also provided a safeguard for the prisons and helped prevent infection control, spread.
At paragraph 41, you say there was a lot of anxiety rather than unrest amongst prisoners. Tell us about that.
I mean, from the outset, nobody knew what we were facing. We had faced in the prison service, our experience was dealing with things for a few days, perhaps not a prolonged period. The anxiety of the virus, the potential of some of the media stories about what a likely impact on that on our state could be, was causing our staff, causing the people in our care real anxiety. They were hearing it from their media, they were hearing it from their family. Our staff were trying to update our population about where we were and what any likely outcomes or restrictions would be to the regime, as I've talked about closing the regime down, stopping people going to work, and that in itself, the anxiety levels, and unsettled our population really quite badly. It really unsettled everybody because there was uncertainty across the estate.
I'll ask more about stopping work and things like that later. You go into more detail about that later in your witness statement. But the next thing which you seek to address is physical health for those in our care. And you begin by talking about the age profile of your prisoners and how that changed at paragraph 44.
Yeah, there's lots of research and lots of evidence that will show you that the age of the population has increased by the statistical data I've provided. It's doubled. It used to be 32.7 years was the average, and it's doubled to 37.4 years. But that only tells half of the story, because a lot of our population who come in have multi-health problems, have underlying health problems and conditions. And again, there's lots of research and evidence that shows you that there's that increased risk for someone's health who is in prison is probably 5 times greater than the normal population.
5 times. Now, I also understand that average is perhaps not the best measure, that there is a skewing in the age bands. There are lots of people who go into prison at a young age and then come out and don't come back, or don't come back for a long time. But there's also people at the other end. Tell us about that.
There are people who come in terms of statistically and get long sentences have increased. They've increased quite significantly. But there's also a growing number of elderly people and old people coming in from historical offences, and that has statistically increased. I don't have the statistic at hand, Mr. Caskie, and I could provide them to the inquiry, but that has increased significantly over the last 5 to 10 years. So that profile of people 50, 60, 70 and above has significantly increased.
The next thing which you are in your statement, and I'm now looking around paragraph 46 of your witness statement, you talk about the need for shielding by certain of those in custody. Tell us about that.
The assessment, with our joint assessment with our healthcare colleagues, provided us with information that identified 125 people across the estate who had significant underlying health problems, who would be required to shield as per the public guidance was. We approached the 125 people in confidence and asked them to try and understand this was a potential consequence, and said, as a result of that, we would have to isolate you because there's a real risk to your health. Only 35, I think, across the estate chose to isolate. The others took the option to remain in circulation and continue to follow what was then the regime within the bubble. So that was the original assessment that was carried out by our healthcare colleagues who work inside the prisons.
Was there ever any attempt to take the 35 and group them together, as it were, or how were they dealt with as part of your bubble?
Yeah, they were dealt with as individuals, Mr. Caskie, because a lot of the discussions, people felt safe. They felt comfortable within the bubble or the household they were with. They felt they had family contact at that time that would still be at that establishment. So taking people and moving them to another establishment and cohorting them was not an option, because the individuals at that time wished to stay and remain in that establishment and stay beside the support and the contact that they had. So that was the outcome of the discussions that we had with the 125 people. So the option to move them all as a cohort into one single place wasn't a good option.
I'm taking this out of sequence slightly, but it's a convenient place to take this evidence. You spoke earlier about rotating, for example, exercise times. How would that fit with individuals who were shielding?
It meant that we had to build time in during that day, that we had to have time for the individual to have time in the fresh air on their own, access to telephones at the early stage before we put mobile phones in, and access and contact to whoever needed to support that individual, whether it be a healthcare person for their medication or any other support. So we had to build in time for those individuals out with the rest of the people in the bubble or the establishment being in the vicinity.
So you have a group, let's say a bubble of, let's say, 15 in a medium-sized prison, one of whom is shielding. How does that how is that managed within the prison in terms of that individual getting exercise, not being discriminated against and not being seen as advantaged?
Yeah, we'd physically have to lock the other 14 people up, allow the individual out, allow the individual that time and space the same as the other 14, and then lock the individual back up and then allow the other 14 people to come out, for example. That's how we did it. They had to be at that safe time in isolation themselves.
Now you say at paragraph 49, you deal with something that you've already to some extent referred to, and that's the consistency of messaging, so that people were getting information from television, from family and so on about pandemic and its impacts. What was the prison doing in terms of advising those in your custody and also your staff?
Yeah. The National Coronavirus Response Group, part of our make-up was our Head of Communications for the Scottish Prison Service, and also on that group was Public Health Scotland, was our Prison Healthcare Network, was our NHS colleagues, and colleagues who were tuned into Five Nations calls at the time, and also the World Health Organization. So the information that came and the guidance that came there would be taken, it would be created by the National Coronavirus Response Group, and that would then be disseminated down to the local establishments or areas in form of guidance, communication or any other medium for that to be communicated to our staff and the people in our care.
Can I go to paragraph 51? And you talk there about physical activity, and you neatly slide that into infection control. Again, can you tell us about that?
I think that in terms of that, it provided us a real safeguard that we could ensure that we had really robust cleaning procedures in establishments. We had a willing group of people who were able and trained, as I said, sorry if I've covered this before, who were keen and wanted to be out, wanted to be active and wanted to be engaged and have that association with their peers and with their staff as well. And that provided a real focus for a number of our prisoners through the pandemic, that gave them a purpose, it gave them a routine, and it allowed us obviously to have a real good, robust cleaning schedule across our estate.
Paragraph 52, you talk about a constant, almost 12-hour cleaning cycle, yes, going on within the prison. But over the page, you talk about, at 53, I think it is, you talk about a core day. Tell me about a core day. What do you understand that to be?
At the outset of the pandemic, prisons typically work 3 shifts. They work an early shift, a back shift, and then there is an 8 to 5 core period where staff work as well. To reduce the spread of the pandemic, we collapsed that shift to almost a 7 till 7 time, and it varied in different establishments, but it was almost like a 12-hour core day that was condensed, that reduced the footfall coming into the establishment, and it reduced, with the purpose to prevent the spread of the virus, both coming into the prison and going out. So we condensed the day.
I think for prisoners, probably the most important part of their day might be their exercise period. What was the exercise period pre-pandemic?
Exercise periods can vary across prisons, but typically it would have been an hour in the fresh air at midday, and then during the summer months people are able to have time in the fresh air in the evening as well, but typically it would be an hour and time in the fresh air around midday after the morning purposeful activity session had finished.
And is the morning purposeful activity session always inside?
No, it can be outside, because we have gymnasiums, we have football field, we have recreation areas that allow people access to that. So pre-pandemic, those would have been used for those purposes, whether it's football, sports activities. But typically, most of them would be in purposeful activity, work parties, or reoffending behaviour programmes, or education.
Mm-hmm. Tell me about the work parties. What kind of things do they do?
Prior to COVID, people would be engaged in anything from manufacturing wooden benches for large retailers. They would be involved in arts and crafts. They would be involved in the basic core services of the prison, which could have been the catering in the kitchen. They could be involved in the cleaning parties that existed. They could be involved in laundry parties within the prisons as well. That's just a range, but they vary from the size and the space and activity available across prison. But that's a range of what's available.
And were there activities, and we'll come on to this when we're talking about education and so on, but were there activities which essentially just stopped?
Yes, there were. Our offending behaviour programmes, where you had to have people in close contact and close vicinity, they closed. Large work parties where there was 20 or 30 people working close together had to close down. We closed down to what we call the essential services, and the essential services were our cleaning parties, our laundry parties, our catering parties. That was predominantly the essential services to keep the prisons functioning.
Okay. Then in paragraph 55, you talk about COVID-19 related deaths in custody, and you provide some basic statistics there. Can you just give us the numbers at this stage?
Yeah, unfortunately there was 16 people who passed in our care. 16 people over a 3-year period, and that was from 2020. I think we had 5 in 2020, we had 9 in 2021 and 2 in 2022. That was a breakdown over a 3-year period.
And since 2022?
There's been no COVID deaths.
Okay. Do you have a formal protocol? Well, presumably you have formal protocols in place when a death occurs.
Yes, we do. The first thing that we would do is have a death in prison learning outcome review, and then there's a formal fatal accident inquiry takes place following any death in custody.
In terms of communicating with families, what should happen?
There should be early communication with family. There should be contact from either a senior member of the establishment, usually the governor, usually followed up by your chaplaincy, or anybody who was close to the individual or the family would be involved in that communication.
And would you arrange, for example, if it's going to be someone who was close, might that be another prisoner, or would it always be a prison officer?
We could bring the family into the establishment if they wish to speak to the individual who was close, who was still in prison as a prisoner or someone in our care, but it's typically somebody that's worked with them either in the employment of the SPS or one of our agencies who have been working closely with the individual.
You say at 58, the first couple of deaths were older men who were isolated and probably, because of the nature of their offences, didn't have contact with their families. How would that be different?
I think in terms of that, the people who had passed away sadly, we knew from our visits contact, we knew from our data that those individuals didn't have any communication, they didn't have any family support. In fact, I'm not sure, I don't know the specific details, Mr. Caskey, but they didn't have any real outside contact. So their friendship groups and their peers, because these individuals had spent quite a considerable time in custody, had been built in and around the prison setting. So we knew that for our first couple of deaths. That was the individual status of the...
Right. So you're talking there about the first few deaths. At paragraph 60, you talk about the next few deaths, and you said typically a governor or a chaplain or a member of the senior management team would initiate early contact with the family.
Yes, that's correct.
We heard evidence before Christmas from a gentleman who lost his son whilst in prison. And the mechanism you describe did not reflect his experience at all. Have you had the opportunity to review what was said at that time?
I haven't personally, and I really apologise if that has not happened, but I've not had the opportunity to either formally review it or actually look at the details of that case, Mr.
The person who sadly passed away was in custody at Addywell. Would that make a difference in terms of your involvement?
It would in the death in prison learning outcome, because our death in prison learning outcomes for the public sector have a specific format. Addywell have a different format. They have to meet the same standard, but they have a different way to do it. They have to procure somebody in to carry that out for them as well. But we would still expect, it's a director, it's not a governor that's in charge, we would still expect a director or a deputy director to follow that contact with a family and follow that through. And apologies, I don't have the details because I have not spoken to the director who was there at the time, who no longer works for the company.
How do you know? How are you making he no longer worked for the company?
It's just it's a fact, Mr. Caskey. They have changed 2 or 3 directors in the last few years.
Right. There will also be another inquiry into the death in Addywell that I'm talking about. Can you explain what that would be? Yeah,
that will be a fatal accident inquiry, Mr. Caskey, and that then will be a more in-depth and a forensic look at the circumstances surrounding the specific death you're talking, or the other 15 in relation to COVID, and that then looks at learning outcomes and what we can do, or other agencies that work with people can do to try and prevent this in the future. That will be scheduled sometime in the future.
I'm looking now at 63, and at 63 you talk about, or around 63, you talk about information that you got in your first week in the job about potential deaths in custody. What was that information at that time?
It was a statistical analysis from our health colleagues and from across the 5 nations, and it was a raw figure at the time that looked at the number of people in custody, the likely impact that a pandemic would have, and what is a high-risk residential area, and that's what prisons were designated as. And it was a figure of 600 potential deaths across an organisation was a statistic that came through a forum to myself from one of their 5 nations call, which had a significant impact, I have to say, when you're told something that can potentially happen in your system.
Okay.
Can I ask you a question about that, please, Mr. Kennedy? You said in the event of a pandemic, you were given this information. It was obviously very early in the pandemic, but you said in the event of a pandemic there could be the amount of deaths would occur. And of course, it is to some extent hypothetical. Do you remember, surely not, what sort of pandemic was envisaged? Because, of course, as we all know, a pandemic can occur from a variety of diseases, and as I understand it, we'll be hearing evidence about this at some stage. We've already heard some in this inquiry, in fact. There are various types of viruses. There are pneumonic viruses, there are enteric viruses and so forth, and they have or tend to have very different mortality rates, and therefore the figure, I'd be interested to know what sort of pandemic. Was it already talking about COVID, which is a pneumonic virus, or was it talking about, well, what was it talking about? If you remember. You may not remember, in fairness to you.
Yeah, I actually can't remember. I don't think it was the developed COVID virus that we then went on to try it across the country. Then there was a lot of speculation, my lord. There was a lot of speculation what the virus could be, what the strain could be, what the potential so it was a hypothesis of a number of likely outcomes at that time, and that's my recollection at the time. The thing that struck me was the astonishing figure.
Yeah, no, I'm not criticising you at all. Just that whoever produced the report, it'd be interesting to know how they came up with the figure of 500, what sort of virus. If it was possible for you to, either yourself or have someone have a look again at that report, and if it did stipulate or state what sort of virus it was or was envisaged, or the figures were based upon more accurately, I'd be grateful if you could write to my staff and let us know that information, please.
Will do, my lord.
Thank you.
If I can just go back to your own personal, of the impact that had on you personally. You've just been appointed as Director of, or Head of Operations in the Scottish Prison Service, and you receive a report which says a pandemic in the prison might result in 600 deaths, about, by my rough back of the fag packet calculation, about 8% of the prison population. How did you personally react to that?
I was somewhat astounded, to be honest, and the magnitude of what that could have meant to 600 people and families and people who built up relationships over years. And I was actually really astounded with it, Mr. Caskey. It took me aback, and if I didn't say it was overwhelming at the time, I would not be telling the truth. It was overwhelming to be faced with a statistic like that.
Is that seared into your brain?
It's clearly had an impact on me, yeah.
At paragraph 64, you talk about that, and then you go on and say it's a great relief that it was 16 and not 600. And you then go on to refer to presumably your own reflections as to what led to it being 16 and not 600.
Yeah, I mean, it's
the second part of the paragraph I'm looking at.
Yeah. I'm not sure you can ever be content that anybody dies in your care, so please can I put that in context right away. But in terms of the support, how we approached it, we always had the focus in our mind from our Chief Executive down to protect people, to keep them safe, and to communicate and be as open, as honest as we can, because we knew we'd have to put in place restrictions. And restrictions within a prison can sometimes have a negative impact on control. But from the outset, we had that mindset to make sure it was clear, our communications was clear, and the support that was put in place to protect and save people's lives was at the forefront of everything that we did.
Mm-hmm. You say that it was not me nor the Chief Executive, it was the staff and prisoners on the ground who respected the rules. They took advantage of the support in place. They respected the restrictions and guidance that was ever-changing, and it's a credit to their attitude and approach that this helped save people's lives and keep them safe. There is absolutely no doubt about that. Is that a typical response from prison management to how prisoners are behaving? Was it different? Was it different then?
There was a sense of community, if I could explain, in prisons during the pandemic, probably mirroring what happened in society, in our villages, in our towns. People came together within prisons because they understood there was a common aim, and the common aim was to keep them safe, was to keep their families safe, both their staff who were coming in every day and going back to their families, and those in our care who at the time were socialising in a small bubble. They were restricted from their family. So there was a common aim for everybody to follow the guidance, take the support that was on offer, understand the legitimacy of what was happening, and then act responsibly. That doesn't always happen within a prison environment.
Indeed, might it be regarded as somewhat unusual in your experience?
I think the word unprecedented gets used quite a lot for the pandemic, and the sense of community togetherness was unprecedented in my 35, 36 years in the Scottish Prison Service during the pandemic.
Thank you. You then, at paragraph 65, talk about changes to the rules that were introduced. And again, that's to do with implementation, so we'll do that on another day. But at paragraph 69, you give a specific rule change about isolation for 14 days. Was that a rule to require individuals to isolate?
Yes, it was. We typically, under our prison rules, we have different rules that allows us to isolate people for different reasons, but sometimes it can be custody, so their own safety, sometimes it can be healthcare. And the specific isolation, when the guidance required that, we had to change the rules in the legislation to allow us to do that legitimately.
And that's the prison rules you had to change.
The prison rules
were colloquially known as the prison rules.
The prison rules.
And that was to permit you to say to a prisoner, you're being locked up in your cell or in a cell for 14 days.
Yeah, and it allowed us to do it at the time for a household, because typically, if you take your example previously, if there was 15 people and 1 or 2 were positive, we would have to isolate the household. So the change in the prison rules allowed us to isolate the household, not just an individual, as the rules would allow us to do in normal times.
So previously the situation had been that you had the ability, for good reason that one would assume, to isolate an individual, but it became more collective during lockdown, and that was a reflection of the bubbles.
That's correct.
At 71 and 72, you talk about testing, when testing came in. Was testing ever compulsory?
We tested on admission, compulsory for people on admission from prisons, and normally it would be part of an outbreak. We would test and make it, say, compulsory. We would encourage people. Some people refused to be tested during that, but it was voluntary for our staff. And it was voluntary for our prisoner population during normal association time within the prisons. But we did test people, or we encouraged people to be tested. We couldn't compel people or take any action if somebody refused to be tested on admission, for example, or on return from another establishment or a hospital. So
if I'm a prisoner and I have a hospital visit, which is essential, and I'll ask you about hospital visits in general in a moment or two, but if I do have a hospital visit and I go to the hospital and I come back in, do I get tested at that point?
We would ask people to be tested. We would encourage them to be tested at that point, but we could not compel or force anybody to be tested.
But everyone in prisons were offered the opportunity to test when they came in.
Yes. That was about September. That wasn't initially. That was about September 2020. We introduced that because we didn't have a testing protocol at the early outset of the pandemic. So roughly it's September, I think, Mr. Caskey, 2020.
Sorry, sir, I interrupted.
No, it's all right. I interrupted. Have you got any knowledge of the uptake of that offer of a test on return from hospital or admission?
I don't have the statistics, but majority of those prisoners or those in our care took the opportunity to be tested.
You say the majority, was it a good majority?
Good majority, sorry.
Good majority.
A good majority too. Yeah.
Right. You'll be aware that we've heard evidence about care homes.
It's good. Yeah.
You'll be aware we've heard evidence about care homes. That didn't happen when people were being transferred from a hospital into a care home. Do you have anything that you can usefully say about that? If you don't, just say I don't.
I don't.
That's fine. I come in back from hospital and I test positive. What happens to me?
You'd then been isolated for the period, whatever the guidance was, it had been 14 days.
I am going back to a cell that's shared.
We wouldn't have put you back to a cell that's shared. We would have found you an individual cell and we would have placed you in there on your own in isolation.
How do I get my food?
Staff would bring it to the door, staff would go in PPE, would bring that to the door, whether it be your medication, whether it be your food or anything you needed, staff would bring to the door, Mr. Caskey.
Okay. 77, you're talking about vaccinations now. Was the vaccination regime that was rolled out inside the prison estate a mirror of what was happening on the outside?
Absolutely. It was an absolute mirror of what was happening on the outside as well. We have NHS staff who work in every one of our establishments, so we then had the ability to be able to mobilise the staff locally and to be able to carry out those vaccinations, so it mirrored what was happening in the community.
So we know that on the outside, the deciding factor as to when one was vaccinated was age. Did that also apply in prison?
Yes, that's exactly what happened. We followed the guidance as well from the age profile. That was a priority at the start, and we worked through that exactly as the community was doing.
Right, I want to ask you about the exactly. You said earlier that prisons were a residential establishment which was recognised as high risk. Was any weighting given to that in terms of inside the prison? Yes. So was it simple age full stop, or were there any, or age and health?
It was age and health, Mr. Caskey, and perhaps, sorry if I've not explained that properly as well, because if the 125 people with underlying health conditions would have been offered the vaccination as well, so there was a health assessment that took place as well as the category of age.
And would they be offered before, if you have a 60-year-old who has an underlying health condition and you have a 60-year-old who doesn't have the underlying health condition, what happened in the community was that person number one got vaccinated first. Did that happen in prison?
Yes.
And again, I asked this question because I don't recall what the answer was. Was any weighting given to the fact that prisoners per se were living in a high-risk environment?
No.
Nothing at all?
No. It was individual health risk assessment and then the guidance from age profile.
The next thing you talk about is NHS appointments. And we know that NHS appointments in the community, for all but the most extreme cases, dried up. I'm in prison and I'm receiving essential cancer treatment. What happens to me?
During the pandemic, there would be that individual assessment, first of all, to see if the place of care or where they were given the treatment was still open. And if it was, then there'd be an assessment how that individual could be taken there and back safely as well. So it was carried out individually. But first of all, we had to then check to see if the appointment was still going to take place.
When the appointment is still going to take place, because it's very important, did your transport agency, who I understand are called GOAME,
yes,
do they still take me?
Yes, yeah.
And am I risk assessed in terms of handcuffs and things like that?
Yes.
And given the requirement in general to have 2 metre distancing, how's that dealt with?
We had developed protocols with our public health colleagues about how PPE would be used to facilitate escorts. So we had a range of PPE that people would utilise if they were transferring people to the cancer appointment as you use. And also there would be that localised assessment to the ward that were going in that would then decide what, if any other measures they had to take. But we had a recognised and a standard set of PPE that we had agreed that was fit for the purpose to carry out hospital escorts.
You mentioned PPE, and that's the first time we've mentioned PPE. I should have mentioned it earlier. Tell me about PPE for your in the prison, firstly.
I suppose early months was a bit like everybody else. What should we be using? What standard should we use? What are we facing? What would combat any risks? But in the prison setting, we already had things like hand gels. We already used gloves for our searching procedures anyway. So we had quite a considerable stock of those localised items, but when it became clear about the specifications and the type of PPE that we required, we used our Scottish Government contacts and contracts, as well as locally when things were difficult to source. We used them early, and we bought in bulk, and we stored them within our central stores, which is in Falthouse as well, and those were then distributed across the establishments. So that's how we handled it.
We've heard some evidence of standard PPE essentially not being designed for women. Did the prison service take cognizance of that in the PPE that your women staff were using?
We took advice from Public Health Scotland and Health Protection Factor exactly about a PPE that would be suitable for all our staff and all the people in our care, and for any of our contractors to use in escorts. So we got a specification of masks, goggles, aprons, gloves that would be utilised from anybody at any time. We did take advice for people who had difficulty in lip reading, for example, so we were able to secure some masks that were clear, but we didn't do something specifically for women.
You were saying for all our staff. It's quite often the case that when it's said this is for all of the staff, what it means is this is for all of the typical staff who are men.
No. All our staff group.
Okay.
All our staff group, whether they were operational, non-operational, and as well we made sure that our people who were coming into our prison, our agencies, our education provider, our escort provider, were following that as well. So it's everybody.
Okay. You then move on in the witness statement to paragraph 82, where you're talking about mental health and well-being. And I'll be quite frank with you, there quite a bit of the material that you've produced is counterintuitive. I don't mean it's wrong, it's just some of it's surprising. What did you find, or what do you think I might have found surprising? What's the oddness, or what did you find surprising, if anything?
I found surprising that people who are already isolated in prison, and then you restrict them even more, and you restrict family contact, and you restrict access to what would be a normal daily regime, typically in prisons can not be the most reasonable or understanding. So I could understand why people would think, why was there not a reaction inside your prison to restricting people who typically have broken the law, and we've taken that choice to put them in there? Why did they comply? Why were they so reasonable? Why did they have the understanding? I would be asking that question as well. And it comes back to the feeling of safety, community, understanding, and trying to ensure that people were safe.
And do you think that was something that was picked up on by those in custody?
Absolutely. There's a lot of our longer-term prisons and our longer-term staff have lived and worked with each other for quite a considerable time. So whilst there's professional relationships there as well, there was a greater understanding that everybody was facing the same risk here, and everybody had to contribute to success, if you want to call success about keeping people safe and stopping a virus spread. That was the common aim that was prevalent across all the establishments.
For prisoners pre-pandemic and presumably post-pandemic, you provide both medical mental health support and what might be called non-medical mental health support. What happened to that during the pandemic?
it was difficult to be honest to meet, because our health services were stretched, they were pushed to the limits, they were involved in other activities, but wherever possible, our colleagues in our NHS continued to provide, whether it was one-to-one support with people in the establishments, but that proved to be difficult during the pandemic.
What about less formal mental health support? You talk a bit about that in 87 and 88.
Yeah. In essence, it was trying to keep people mentally tuned in. So it might seem simple things now, sitting in front of a table here, but it was puzzles, it was games, it was in-cell activity, it was just like a sense of... A number of our establishments have media systems that we could use, so we utilised sessions that can be beamed through televisions, it can be a selection of films, it could be a selection of information or guidance or whatever, so we utilised lots of things that could stimulate individuals whilst their life in prison was basically restricted. So we did that to the best of our ability. And it might seem simple, and I have mentioned in things like that, but things like bingo actually worked for a community, and at times you can play bingo when people are locked up behind their doors because you can still call the numbers. So it may seem simple and it may seem quite a strange things to say in an inquiry, but things like that was the extremes that were happening within the establishments to try and keep people stimulated.
Give a graphic description of the volume of noise when bingo was being played. Tell us about that.
It was only my experience in one of our establishments, and I did, through the pandemic, as you can imagine, visit establishments very regular, and it just astounded me that there was a pin drop whilst this activity was happening while I was in one of the establishments. So it was astounding, that's all, and it was just so quiet.
Paragraph 89 you're talking about. Paragraph 90. You talk about this, people becoming closer together. Again, tell us about that.
I think it was a sense of, well, there's a practical thing that helped that work. Typically in a prison there's a regime that people will go for morning activity, they will come back to a residential area, so they'll go from where they live to work in an area with different staff, then they'll come back to the staff who work in that area. So people were closer together, physically closer together for that core day. So that in itself added time to what people could do, develop, work together and build a relationship, where typically a lot of things in prison are transactional. People move to visits, they move to their work party, they go to the gymnasium, so it can be quite transient. A lot of that was stopped, so it actually meant people were physically in the same area for a fair percentage of that time for that day, and that in itself encouraged the growth and development of relationships. Because it was the same prisoners or prison officers they were dealing with all day, yeah. And the same prisoners. And there was consistency.
Yeah.
We have about 10 minutes, Mr. Caskey.
Doing my best, my lord. Talk about regime change over the course of lockdown and so on at 92. Tell us about the changes in regime.
Initially, as I said, we stopped all our non-essential work activity and services. We stood that up as quickly as we could when the restrictions were changing, but what we tried to do was do it in smaller numbers. So rather than just allow everybody to go back to a gymnasium in numbers, we utilised small wing gymnasiums, small areas, for example, that we were able to build up the activity again in smaller numbers, but safer. So we did that, and we went through a process from closing it down to a gradual build-up till through the end of the pandemic we were able to have that normalisation. So it fluxed over the course of the first 2 years at least when the restrictions were in place. And that was the same for visits, because There was times we were allowed to have visits because we designated our visit area as an indoor public place, and we had agreed that with our public health colleagues, so we were able to utilise that. But as I explained earlier, at times when travel restrictions were in place, families couldn't come to the visits. So it had to bend and change given the guidance.
You talk about physical visits at 97 and on, and you indicate there that in March 2020, physical visits were suspended. And then in paragraph 98, you say physical visits fully resumed on 26th April 2021. So that's 13 months, roughly, or 12 months. Yes. Those of us who weren't imprisoned were going out for walks and were socially distanced meeting people. Yeah. Why were prisoners different?
Perhaps I should explain that, Mr Caskey. That meant that all restrictions within the visits were removed at that time. We were able to run our visits as they did, as you would in the community. We had people, we restructured our visit rooms that people were physically distant. They had to wear masks at times, but they still allowed that face-to-face visits. But we had our PPE in place and we had safe protocols. So April is the date that all those restrictions were lifted, but physical visits did take place, but with the pandemic protocols in place and safety measures to make sure people could do that safely. So that perhaps explains that a bit better.
You, at paragraph 100, and for quite a while thereafter, you talk about mobile phone technology. You explain about the practicalities for the prison service in terms of organising that. That's to do with implementation. Tell me what happened with mobile phones for me as a prisoner.
You would have been given a mobile phone. Previously that you would have pre-approved numbers that we have that you would use from an area phone. We made sure that those pre-approved numbers were placed onto a mobile phone. You'd have been given a mobile phone in your cell. Somebody would have explained how it works to you. They would have told you that your numbers are on it and explained to you that the phone has outgoing calls on it but not incoming calls, and then the security procedures, and people were given 330 free minutes to then use to contact their family. So as a prisoner, that would have been explained to you right across the estate individually.
And so would I have a number of telephones logged in on my phone when I received it, and I could use 330 minutes a month?
Yes, we preloaded them onto that phone, and that was the recognised numbers that people in our care had been using pre-pandemic, and then we allowed them to gradually change that if and when, and we would normally do anyway, if new people or new family members came onto that list. So initially we preloaded it, gave it to those in our care with the minutes already on it, and they could use it.
Paragraph 108, you talk about some prisoners being quite surprised when a prison officer turned up and gave them a mobile phone. Tell me about that.
I mean, in practical terms, the prison stops us using communication devices. It's against the law to bring a communication device into a prison. That's the starting position. So some prisoners found that after years of us taking phones off them and basically going through a conduct issue, that we would now be handing people mobile phones for them to use and to be able to contact. So they found it quite a departure from our normal practice.
And both the fact that they were able to use the mobile phone and the fact that they were being given mobile phones, did that impact on the individual prisoner's mental well-being?
All the feedback we've had from those in our care and our population said that it helped them greatly during the pandemic. It gave first-hand contact, direct contact at any time with their family, because previously you could only use phones when the prison was open, because these were in typical landing areas as well, so they had flexibility and freedom to contact their family across a day at a time it suited them and their family, and it allowed them privacy more privacy than they'd ever had, because if you're talking on a communal phone in an area that's not perhaps as private as in your own cell on your own time, and that was hugely welcome for the population.
In paragraph 110, you talk about drug seizures. This was particularly the aspect that I thought was counterintuitive. Just tell us about that.
My experience would have said that at a time where you lock people up for a prolonged period of time, there would be a high risk of people lapsing into substance misuse, and then the risk of people's health and death increases. That was not the case. We didn't experience that. We didn't experience an upsurge. We didn't experience statistically moving up on the ground. People weren't reporting that. I've kind of have a few ideas. Perhaps supply routes were disrupted for drugs coming into prison, the same as communities were disrupted. Perhaps physical contact being reduced didn't allow drugs to come into prison. People were not able to go out and throw stuff across our walls or our fences because they were not allowed out. So there's a number of measures there that stopped the supply of drugs coming into it. Didn't eradicate it, but it stopped the supply, which thankfully meant it didn't have an outcome or an impact that typically you would have expected.
Possibly apart from family visits, the most important thing to many prisoners will be the offending behaviour programmes, because they're progress to the door, to getting out. Yeah. What happened to the offending behaviour programmes?
Given the high risk of small groups of people being in a confined space in an area together, if you could envisage almost like a small classroom was where most of the work took place and focus work, we had to set them aside for quite a period, but then we started to build them up again gradually when it was safe to do so in smaller numbers, but initially we had to close them down because they were high risk.
Okay. There are two other areas that I want to speak to you about, and I can do that very quickly. You talk about the early release scheme that was introduced. Just in broad terms, tell us what that was.
Given the threat and the risk to the virus spreading through the prison, we initiated an early release programme on the authority of the Scottish Government that released hundreds of prisoners earlier than they would normally have been released, so it reduced the risk of pandemic spreading across the estate.
You had fairly strict criteria as to who might get early release, and I think across the prison estate you identified, looking at paragraph 132, 445 people to be released. In fact, 348 were released. What about the other 100?
They were assessed as being too high a risk to release into the communities.
But I thought the risk assessment had been carried out in order to identify the 445.
It had been. That was the initial group from an initial set of criteria. Then there was localised assessment by the governor and the team, because a lot of information can be dynamic and there can be intelligence at local level that would exclude someone being released. So there was a veto by the governors, who were able to carry out a local assessment after there had been a larger assessment to create that 400 plus.
You deal in some detail with changes in shift patterns and regime change, and also SPS staff at 139 through to 148 in your statement. You had to change the work pattern. Tell me about that.
We changed that in March 2020. We had to alter it to keep our prisons safe. We had to ask our staff to be flexible and change work and life arrangements to accommodate the safe running of our prisons, and that wasn't taken lightly, because people have childcare support, they have school issues, they have family support that they're required to have in place. So we had to ask our staff to be flexible in very, very short time frame and to be able to adapt their lives to come and work different shift patterns.
You've provided a very detailed witness statement. Do you adopt all of that witness statement?
Yes.
Okay. You also indicated to me prior to the hearing that there were a few specific groups of individuals that you wish to thank for their involvement.
Yeah, I mean, first and foremost, I hope it's come through my statement, but for the people in our care would be the first people often maligned, often not seen as responsible citizens of Scotland. But if it wasn't for their understanding and their forbearing and their understanding that the restrictions were being put in place, imposed upon them in an isolated environment, they acted responsibly. So I think that has to be recognised, and it's hugely significant. It's something that I haven't seen to the extent over my 36 years in the Scottish Prison Service. So I think that has to be acknowledged. And our staff group, who were frontline every day, working with our NHS colleagues, our partners were in there, they did our best, and they had the safety of everyone at the forefront of their mind on a daily basis. They changed their work approach, they were flexible, and they adapted and flexed and bent at a time where their family life was being changed and their work life was being changed. And if it had not been for that, then our organisation and the Scottish Prison Service and the people we look after would have been in a different place. So I'd like to pay tribute to both our population and to our staff group and our partners who supported us to do this and achieve it.
The other two groups that you mentioned to me before the hearing were those involved as as second sector partners, for example, education, and also your third sector partners, and you specifically identify in your witness statement families outside. Is there anything specific that you want to say about them apart from extend your gratitude?
Really extend the gratitude. I did mention family outside because hugely supportive and trying to provide a consistent change in message to families who come to our establishments, both on their website and both physically on site when they came here, and to our partners who really were not our employees but adapted our safe procedures when they came into our establishments and contributed to the overall safety. And I think it's only right that I acknowledge that in my statement, Mr. Caskey.
Those are all the questions I want to ask you, and we're slightly over time. Is there anything else you need to say?
Not at this point.
Thank you. I'm sure you'll be invited back to talk about implementation.
Okay,
thank you very much.
Thank you.
Thank you, Mr. Purdie, for your evidence, and I look forward to seeing you again at a later stage.
Okay, thank you.
Thank you, sir.
Thank you.
1:30 then, ladies and gentlemen.
Yes.